10 Surprising Facts About Contraceptives. Hello lovely YouTube family, welcome back to Healthy Drops. In today's videos, we're going to talk about 10 surprising facts about contraceptives. Before we start, I would like you to hit that red subscribe button so that you never miss out on any of our videos. Here are 10 surprising facts about contraceptives. 1. Most American women between the ages of 15 and 44 use contraception. According to the CDC, nearly 2/3 of women in this age group are currently doing some form of contraception. Your first non-surgical choice is the pill, followed by long-acting reversible contraceptives such as IUDs and implants. 2. Younger women are less likely to use contraception than older women. About 62% of women between the ages of 20 and 29 are currently using contraception, compared with 72% of women aged 30 to 39 years who reported using contraception and about 74% of women over 40 who are using contraception according to the CDC. That trend concerns Lindsay Longaret, MD, and OB-GYN at the Texas Children's Pavilion for Women in Houston because younger women, she says, including those in their early 20s, would likely be impacted the most by an unintended pregnancy. 3. Women's sterilization is permanent but is also popular. According to the CDC, fallopian tubal ligation is the most popular contraceptive method among American women and is currently used by 18.6%. The use increases with age from about 1 in 20 women ages 20 to 29 to nearly 2 in 5 women over 40. The procedure permanently prevents pregnancy by closing or blocking the fallopian tube so eggs can be fertilized by sperm. Still, there is a low risk of ectopic pregnancy after sterilization, warns Dr. Longaret. 4. The pill is popular, but it's not for everyone. While the pill is still the most popular reversible form of birth control, the CDC's data found that use decreases with age. It's used by 19.5% of women in their 20s, 11% of women in their 30s, and 5.1% of women in their 40s. An advantage, Longaret says, is that it can be easily stopped if the woman wants to get pregnant. Taking the pill can also ease symptoms of difficult periods, PMS, and acne, says Linda Rice, a certified nurse midwife at the Boston Medical Center. Both combination birth controls, which contains the hormones estrogen and progestin, are not the best choice for every woman. And 5. Not only do these oral contraceptives have to be taken every day, preferably at the same time, but they can also raise the risk for a blood clot, according to the National Blood Clot Alliance. Smokers over 35 and women with a history of blood clots or breast cancer should opt for another contraceptive, the CDC says. The mini pill could be a better choice for some women because the mini pill contains only progestin, Rice says. It's a good choice for women who need to avoid estrogen, such as those who might be at risk for blood clots or are breastfeeding. Possible side effects include irregular or non-existent periods, mood changes, nausea, and headaches. Number 6. Contraceptive patches or rings may be easier to stick to than pills. These have the same hormones found in most combination birth control pills, estrogen and progestin, and carry the same risks and benefits, Longaret says, but they have a more favorable dosing schedule. In general, says Sally Raffi, PharmD, a pharmacist specialist at the University of California, San Diego Health System and birth control expert, the patch is replaced weekly and the ring is replaced monthly, which is a lot less remembering than the daily pill, and another type of vaginal ring that needs to be replaced only once a year is also available. 7. A progestin shot is another form of birth control for women. These injections are given in the buttocks or arm 4 times a year, according to the CDC, but because the shot can reduce bone density, it's usually not recommended. If there's no birth control alternative for you, it's important to get enough calcium and vitamin D, Dr. Raffi says. In addition, the injection can increase the risk for cardiovascular disease, especially among women with pre-existing risk factors or a history of stroke, vascular disease, or poorly controlled high blood pressure. 8. IUD use has tripled in recent years. Among women ages 15 to 44, 2.4% reported using an IUD in 2002. That rate rose to 7.9% between 2015 and 2017, according to the most recent data from the National Survey of Family Growth. 9. The latex male condom is the only method that protects against some STIs. Latex and polyurethane condoms are the only form of contraception that have been shown to protect against some STIs, including HIV. The benefit of condoms is that they protect against sexually transmitted infections and are available without a prescription, Rice says. Number 10. The best birth control is the one that's right for you. Before you settle on a birth control method, Think about your ability to take medication consistently, whether you plan to have children and when, and your pre-existing medical conditions. Longer it says, then talk openly with your doctor about your needs and options. That's all for today, folks. I hope you liked the video. If you did, make sure to hit that like button and subscribe to the channel so that you never miss out on any amazing videos from us.